Hello, everyone, and welcome to this Wednesday's version of Collabcast with Sam Brown. Really excited today. We have a special treat for you. We're talking today about the future of the medication supply chain and the technology's crucial role in it. So we have with us today two different presenters. We have Dr. Rola Kaakeh. She's the CEO of Salus Vitae Group. And we also have Charles Drayton, and he is a chief technical architect at Microsoft. So really excited today. We'll get more into the introductions and allowing our presenters to share with you. But just wanted to take care of a couple of housekeeping items first. So first off, definitely want you to know, everybody always asks, after this, everything is going to be on our healthcare and life sciences blog. So you will find the recording, the resources, any questions that were asked and we wanted follow-up items. All of it's going to be there. That's aka.ms/HLS blog, aka.ms/HLS blog. All right, so today we want to make sure that you get your questions answered and that we keep this really engaging. So ask, ask, ask. Make sure that you get your questions answered. We have these experts here. We don't always get them on these calls. We're really excited to have them, and they're here to answer. So not only ask questions, send comments, let us know where you're from. We'll do some shout outs. We get people internationally on all of these webcasts, so would love to know your name, where you're from, just so that we can have a more personalized experience here. And again, at the conclusion of this, we will post all the recording and resources onto our HLS blog. So you might be asking, if you've never come onto the team's live events before, how exactly do I ask questions? So on the top right-hand corner, you'll see a question mark at the box there. That's where you click to open the Q&A panel, and you can type your name. This is a public open access, so you can keep it anonymous, but we love to know your name and where you're from. So ask a question, send a comment. I'm going to be moderating it, and I will look at your questions. I might respond to you privately if there's a really good theme around, where we're trying to go and something that I think that everyone can benefit from. Then we'll post it publicly. We'll ask our presenters. So we'll keep it going along the way. So ask away. So without further ado, want to introduce Dr. Rola Kaakeh. She is the CEO of Salus Vitae Group, and it's a healthcare consultancy. She is also a pharmacist, an entrepreneur, an educator, a mentor, and a published scholar. So she teaches at Northwestern University, the Feinberg School of Medicine, and she's affiliate faculty at the Institute for Global Health and the Institute for Public Health and Medicine. And she really has a wide impact. Her impact has stretched internationally across a lot of different communities, including on the ground initiatives. And she really has a passion, as we'll come across during the presentation, to improving access to medications across all different communities globally. So she recently authored the series titled Tackling Low Medication Supplies and Disruption in the Supply Chain Amidst the COVID-19 Pandemic. We're going to provide a link to that afterwards if you have any interest in following up. I've gone and checked it out. It's pretty awesome. She actually also presented on numerous occasions across different stages, including her recent TEDx talk called The Struggle to Access Medications. That's one that we'll definitely ask her questions about today. Really fascinating work. And she's collaborated with professionals across all different sectors. So really excited to have her on today. She's actively engaged with the community, and she knows about the medication supply chain on a local level, but also on a national and international level. So please feel free to ask her questions. And without further ado, we'll turn it over to Dr. Rola Kaakeh.
Hello. Okay. Thank you so much, Sam, for the introduction. And of course, thank you to Charles and Sam for the invitation, as well as kind of the Microsoft team for being here with me today. So just to give you a little background on Salus Vitae Group, it is a healthcare consultancy that helps institutions design and build their capabilities to improve their processes in order to improve things such as healthcare delivery, costs, access, which is one of our top priorities, and then quality. And of course, with the central mission of improving health outcomes. Now, we focus on 5 key elements, which is education, policy, practice, research and social enterprise. And our goal really is to provide richer information and design innovative practices and help create measurable and sustainable impact to organizations and communities. Now, one way we work towards this is by collaboratively working with and learning from diverse stakeholders across various sectors. Now, we decided very early on that our conversations and then our initiatives need to include diverse stakeholders. So that's a collection of experts and leaders and individuals and really communities that are willing to work together to tackle the issues and create sustainable solutions. Now, as a society, we've come to realize that the transfer of knowledge and information across disciplines is far more powerful than any one discipline could achieve alone. And this is why such a gathering is important. So I really thank Microsoft for hosting this webinar and bringing us together to talk about the topic of the supply chain, the future of the medication supply chain. Now, access to medications in general is not a one discipline problem. I strongly believe, I think like many others here, that our solutions will not just come through the healthcare space. We need experts and innovators in the world of technology, business, engineers, law, and communication to really work side by side. We're required now more than ever to continue to find new creative ways to work together. I think it's our responsibility to understand various stakeholder incentives, identify our shared interests, and create a collective plan forward. The current COVID-19 crisis has only amplified the need for this. It's fascinating and remarkable to see how the various different stakeholders are coming together like never before. I've focused my efforts on the topic of access to medications for over a decade now. I'm also a pharmacist, like Sam had mentioned, so I've seen the impact of lack of access on the ground and in various healthcare settings. Back in 2011, which we consider the peak of the drug shortage crisis in the United States, a group of researchers and myself published a paper titled "The Impact of Drug Shortages on US Health Systems." And this shed light on the drug shortage crisis, but it also tried to quantified the personnel resources required to manage drug shortages. And since then, I've been very involved in the education and training regarding the management of shortages, understanding the various dynamics involved, and really helping evaluate and design processes from institutional levels to policy levels to really improve access to medications. Now, most recently, as Sam had mentioned, I put together a short series on how we should tackle low medication supplies amidst the COVID-19 pandemic. I think this is something, in whatever industry that you're working in, is something that you we're thinking about and are continuously thinking about. And so the series has the 13 short articles, but today we're going to briefly talk about the supply chain and then focus more on alarms and strategies from the series. So really today I come to you with my insights and perspectives as to what I've learned throughout the last decade. But I do have a request for those who are listening. As you're listening through the podcast, I would like you to keep two major themes in mind. The first is the power of technology and how it can be utilized for each of the items discussed. So start thinking through how potentially predictions or planning or using real-time data could benefit this particular scenario that we're talking about. The second is the role and perspective of each stakeholder within such a global and diverse supply chain. I would suggest start by looking inwards. That is, just evaluating your own perspective. What is your perspective? Where are you coming from? You may be a part of Microsoft, so you might be also in the technology space. You might be a healthcare provider. You might be a healthcare institution. You might be a governing agency or an insurance company or a manufacturer. So there's different stakeholders involved. The key, though, is to recognize that people operate in such different settings and they hold diverse perspectives and they have distinctive skill sets. But we also have varied incentive structures and decision-making processes. So as you evaluate your own priorities and incentive structures, I challenge you to think about what you could provide to the other stakeholders involved in the supply chain to assist them. That includes identifying what tools others may need in the supply chain to assist them. So it allows you to actually think about more of your individual versus your collective responsibility. So your individual responsibility based off of your incentive structure and how you're building, but the collective responsibility as a member of the supply chain or as a person or entity that may impact the health and well-being of individuals. So let's start with discussing some realities of the global pharmaceutical supply chain and specifically a little bit more about drug shortages. There's no way that I'm going to be able to talk about everything in 25 minutes or half an hour, even an hour. So we're just going to be focusing on some specific alarms and strategies. Now, to put things in context, the pharmaceutical supply chain is quite complex and global. It's a sequence of many moving interdependent parts, and it involves numerous diverse stakeholders. And then you couple that with a vulnerable and fragmented healthcare environment consisting of several operational and systemic flaws. Now, the supply chain embodies manufacturers, suppliers, distributors, health systems, patients, and numerous other stakeholders. It includes things like active ingredients, manufacturing of the medication, packaging materials, labs, the design process, the final product, and the delivery of medications to health systems, providers, and patients. And the manufacturing and distribution of a medication is a multinational process. If you just look to the US, the FDA has reported that about 80% of our active ingredients and 40% of finished medications actually come from sources outside of the United States. So this is pretty significant. What we do have to keep in mind is that the supply chain was already experiencing significant shortages for years prior to COVID. And with hundreds of medications already in short supply, a global crisis like COVID create additional burden on the supply chain. Now, drug shortages are considered a public health crisis across the globe, not just now, but prior and have always been. They significantly impact patient safety, drug therapy, costs, and operations, and really how we access and manage care. And these concerns are only intensified during the crisis. Now, the issue of drug shortages is not new, as we've had these since we started manufacturing drugs, and we will likely always have them. But the real concern is that there still remains a high number of drug shortages, and their duration are much longer. And so they're occurring at an alarming frequency, and they continue to have a significant impact. So we have to keep in mind that any medication may be susceptible to a shortage now or in the future. However, during COVID-19 and during this pandemic, medications that are used during intensive and emergency care are particularly vulnerable during this time, right? So just on a basic level, we need access to medications in order to use the ventilators, right? So medications such as sedatives and paralytics. So we have to constantly face the reality that continuous access to all the medications needed is not a guarantee, regardless of our location or even how vital the drug may be. And this is true now more than ever. Also, we have to keep in mind experiencing any disruptions in the supply chain can lead to not only drug shortages, but delays and halting of clinical trials, right? We can get delays in clinical trial recruitment, and that's actually also creating an additional barrier for future innovation. Now let's briefly discuss some alarms. So the 12 that you will notice on the slide come from the series, and we highlight these in the series, but I'm going to quickly discuss them and then just add a little bit to them because these were from April and I think they still apply, but information constantly changes and kind of grows. So the first alarm that we noticed during the pandemic, and I think, again, you have to keep in mind these are alarms that existed pre-COVID as well, but are amplified and are much more of a concern to numerous stakeholders given the situation. So the first is the disruption in the supply chain due to restricting imports and exports. Remember I mentioned that the supply chain is quite global and there's a global reliance on all components of the supply chain. So we depend significantly on both India and China. So with an estimated about 20% of the world's generic drug supply is manufactured in India. And India actually also relies heavily on China for its active pharmaceutical ingredients. And so any sort of restrictions or restrictions regarding imports and exports can greatly affect countries kind of across the board. There was some talk early on about India restricting certain pharmaceutical ingredients or medications, but those were later relaxed because there were significant concerns within that. Now, while such decisions are actually made in an effort to prevent drug shortages within the country, the potential impact on the global supply chain is worth noting. And so understanding where that goes is extremely important. Now, so from that, we began the conversations around whether manufacturers should start focusing their efforts locally. And so this is particularly interesting because it necessitates not only increasing the number of manufacturers locally, but an overhaul, right, of the geographical location component of the supply chain. So where we get our raw materials and where we get our finished medications. So this is actually also very costly, very time consuming, and there's a lot of regulatory requirements. And this is particularly worrisome if you're a generic manufacturer and you have to move your plant locally. It's going to cost you sometimes hundreds of millions, and you already have a very small profit margin. A lot of the drug shortages we've been experiencing are from generic manufacturers that have pulled out, and then there's less manufacturers producing that medication. So manufacturing facilities take several years to build, right? 5 to 10 on average, and can cost millions or even billions. So you might begin to see a mandate for maybe a percentage of the healthcare supplies or medication supplies being sourced domestically. And you might also start seeing regional hubs, independent supply chain based off of our regions, like in the United States or Europe or whatnot. And so we'll begin to kind of see diversifying where we get our active ingredients and creating kind of a backup plan to how, instead of how things are done now. We also have the emergence of more unregulated supply chains. So when a shortage or a restriction occurs, we're left with a very limited number of sources. And so then there is the emergence of unregulated supply chain. And then the introduction of an unregulated supply chain becomes breeding grounds for the introduction of adulterated or falsified medications. And I think technology can play a huge role here with traceability and trying to learn the whole path that the medication takes. The next is the interruption of delivery and transportation of raw materials and finished medications. The pandemic has reduced distribution channels and opportunities for quick delivery of products. I think we've seen many that are starting to create, have created and are really starting to think more creatively how they utilize technology for product distribution, right? Some are using drones for delivery, some are creating faster and more efficient systems for delivery. The next is the impact on the workforce. Now, not only has the pandemic impacted the physical infrastructure of the supply chain, but also its workforce, right? So when factories started to shut down due to social distancing, we started seeing a reduction in the workforce. And then you also have the strain that the pandemic has put on the various individuals that are responding to those crises. We know that even pre-COVID, any disruption in the supply chain led to a significant increase in workforce time and effort. So even from a health system perspective, when they can't get a medication they need, the management of that consumes a significant amount of their time that they take away from patient care. So institutions really have to build their capacities to manage these disruptions. They have to sometimes expand their teams and hire new people or really cross-train. So the opportunity for the use of technology here is very evident, right? And some people have also used more automation and robots and found other ways to reduce the reliance on some labor when possible. There's also a lack of information. Now, the quality of the existing data is poor and insufficient to manage the crisis. There's a lack of complete publicly available information regarding resupply dates, reason for a shortage, maybe the location of a raw material and manufacturing facilities, which is important to have if you're trying to plan ahead, and many other items. But these have been issues for years, right? But we've realized that when we obtain more information, we're able to resolve them faster, and that contributes significantly. So there is definitely a need to build and optimize reporting and surveillance systems, and there's a significant demand for more information, transparency, and accountability. Now, there's also numerous reasons for disruptions of the supply chain. So if there was only one, we could all work towards that one reason. But unfortunately, there are multiple reasons. So that means multiple interventions have to occur at the same time. Also, we're faced with this whole dilemma of continuously planning and the change under uncertainty, right? We have to make decisions quickly. Things are constantly changing based off of the data and the information that we have. So there's definitely a time urgency associated with kind of the world that we live in now, but really if you think about it, there's a time urgency associated with medications in general, right? How we administer and how we provide all makes a difference. We have to quickly plan and we have to quickly make decisions. there's also an urgency resulting from our collective need to really reduce the cost on human life and economic impact. And so just kind of keeping that in mind as we go forward. The financial aspect is very interesting to me, because we know that pre-COVID, any disruption, so a drug shortage, can result in significant increases in costs, right? The cost to acquire, the cost of time, whatnot. In the case of now COVID, and as we look to create a vaccine and that whole structure of like what medications are available for the treatment of the condition, we've seen that societal gains have actually taken priority over financial gains. But the real question is for how long? So we saw companies early on donating millions of doses of hydroxychloroquine to the stockpile. We're seeing leading pharmaceutical companies come out and say that for COVID, they're operating as a not-for-profit business, and so they're not expected to make a profit, and any of the contributions they have, they're going to also, contribute, provide donations for those who need them, and invest in emergency preparedness. And really seeing it around as a conversation as it's a global public good. But really what remains unclear, and the information that we really need to know, is how will price regulation change, how will it impact access, and what are really our current realities moving forward. Then there's also the alarm of the stockpiling and hoarding. So there's been a need to make our stockpiles more comprehensive, and that they need to maintain stockpiles of medications that aren't just COVID related. So we need the information to be able to know what medications we need to stockpile in case of emergencies, right? And then the whole concept of hoarding is just buying a lot of medications in hopes, because you feel like there will be a drug shortage, which again, there's pros and cons to how we look at it, and how really trying to understand the impact of stockpiling and hoarding on access. The last thing for the alarms is really about sustainability of interventions. So we need to discuss the sustainability of these interventions and really have a conversation around the longevity of our policies and practice. So how sustainable are our approaches? Are they working? Are the processes only temporary or long-term? Can we create processes that are long-term? And so we have to constantly evaluate that. And the supply chain, if you even kind of thinking about it from a broad perspective, they have to be equipped to meet current needs and future needs. So a pharmaceutical company has to ensure the continuity of their existing supply chain in order to ensure that patients receive their needed medications. But for new medications and vaccines, companies actually also need new production lines. So they might need to repurpose. Production lines or create new ones. And so again, if we think about it, pre-COVID, we were already struggling to provide equitable access to all medications. So this is not going to be an easy task. In the case of a new treatment or vaccine, a couple of things that I just think about on a basic level and questions that I ask is really, what is the amount we need? Who has the capacity to produce? How fast can we get it? Who will get it first, right? And the price. And so these, I think, are questions that are constantly being asked, and multiple stakeholders are involved in helping answer those. Some other, some quick questions and challenges that I'd like to acknowledge in kind of addition is really, again, around the revolving topic of our ability to scale to meet our needs. If you think about the quantity that we would need in terms of a vaccine, it's extremely significant, right? Like everybody in the world would need access to it. So our ability to scale and price will be very interesting. What risk means and how we utilize information to reduce uncertainty, that will help as we move forward. And so data will really help us not only understand the past, but really plan for the future. But I always like to kind of think of more these kind of controversial questions, or really trying to think about what are other questions to keep in mind, is really the sharing of too much information. And can that lead to a shortage, or can that lead to price gouging? And so really understanding how we are moving forward will be really important. Okay, so now we'll quickly go over some strategies that I think are applicable to all healthcare, or actually all stakeholders, regardless of your role. And the first one is to evaluate your processes. So each institution and professional must rethink how they do things, right? we have to reflect on how we respond to these challenges, and we also have to evaluate what information we have available and what we still need, right? On a very basic level, is something paper-based that can be automated? How are our current practices relevant to the current environment? And how will we adapt to those needs? It's going to be extremely important as we create strategies to address not only the current issues, but we actually have to create strategies to prevent and manage further disruptions. The next is to create practice guidelines, contingency, and risk management plans. The plans should outline situations that entail the operations during and post-pandemic. I think this is very important. We're not just working towards, finding the resources and working together to just tackle this. We have to think of our processes after. So, are you setting up your infrastructure kind of like a post-COVID? So that means you have to revisit your existing guidelines, and information will really help in driving what guidelines are important to you. And we're actually going to see so many different types of business models across the supply chain in the next coming months or even years. And then there's also the issue of evaluating workforce utilization and discovering new strategies to optimize output and reduce burnout. There's also a greater emphasis on technology and drive for innovation. I know technology is the focus of our talk today. It was put as one of the various different strategies within the series, but because we live in a time of urgency, technology can be really leveraged in new enhanced ways to improve access, efficiency, partner with diverse stakeholders, and really generate greater information. There is significant investment in technology and automation, and stakeholders are much more open to discussing how we can harness digital tools moving forward. I think technology also plays a bigger role in quality assurance and helping with that as well. So opportunities, I think, are endless there. Engaging diverse stakeholders, I think I've said this a lot throughout the presentation, but really leveraging expertise, perspectives, innovation and technology from various disciplines is going to be integral to how we do things. But a question to keep in mind when you think about that is something I think about a lot is what can organizations or regulatory bodies require of each in the supply chain? And how does one regulate or enforce such a strategy? So we'll continue to talk about that as the supply chain is adapting to what's going on. And then next is really to reevaluate your regulations and advocate for greater policies. So evaluate your current policies and regulations that are affecting not only your institution, but the supply chain as a whole. And I think the future will really entail greater data-driven policies. So therefore, I think real-time data will play a much greater role and should play a much greater role there. And then really is to be a part of information sharing. And that's from tracking, reporting, and surveillance. Now, information sharing will continue to be extremely vital. The better data we have, it'll drive better policies and better strategies, right? From a supply chain, it'll help inform our plans, our inventory management, how we allocate our budget and our resources now into the future. It'll help us determine what advocacy efforts we need to create better policies. So really information empowers and assists everyone in the front line, kind of the front line of the supply chain to understand that. Right, the ability to aggregate a tremendous amount of information across stakeholders will really improve access. So there's tremendous opportunity here. I think we should build off of the fact that we've rallied behind a people vaccine, and this has allowed us to share data and information and technology like never before. So we really have to evaluate the existing systems, whether they're set up to really document the impact of disruptions, when a policy change occurs, how that affects patient outcomes and health systems. So really data generated will assist institutions in identifying their frameworks, their processes, their resources. Early detection, predictions, and projections of disruptions are also really critical. And so having that additional information, we know from a drug shortage perspective that when we were able to get more information ahead of time, we're better able to manage drug shortages. So I think also just as a question to keep in mind with information sharing, there's a lot of conversation around the role of voluntary versus mandatory reporting and transparency and accountability. So we'll see how that kind of plays out as we all begin to pool our resources to share the information we have, to be of most use, right? So the true value of the best technologies for prediction and forecasting is really revealed when the relevant partners are able to benefit from that. So we need information that can drive action or behavior to the appropriate stakeholders. Just kind of in closing with that, I think it's important to note that as we all work together, as we try to strengthen our supply chain and try to respond to increased demand, we must remember that there's no one solution, right, that will fix it all. So this is a multifaceted issue that requires multifaceted solutions. And so we have to identify that collectively and really understand, leveraging the resources that we have, what impact it has. So I think technology coupled with partnering with diverse stakeholders that really know the needs on the ground play a significant role in moving forward.
Awesome. Thank you so much, Rola. And it's awesome to have the industry expertise and context mixed with what we are about to hear next from Charles Drayton, who is a chief technical architect at our Microsoft Technology Center in Chicago. So he has a presentation for you as well. We're going to talk a little bit more about, now that we've laid the groundwork, how does technology play a role within the supply chain for medication? So Charles, I'll let you take it over from here.
All right. Well, good morning, good afternoon, or good evening, depending on where you are. My name is Charles Drayton with the Microsoft Technology Center. So the MTC, briefly, is a series of facilities, 15 in the US and 50 around the world, that provide various types of specialty consulting. I'm actually broadcasting to you from the Intelligent Healthcare Experience here in Chicago, which is a replica hospital space that is designed to go through the entire continuum of care. So if you are in the healthcare area, I invite you to Chicago to, once we reopen due to the pandemic, to come and take a look at some of the things that we are doing in terms of technology for digital transformation across the continuum of care. So that being said, Rola, I really, really appreciate the insights that you made, and I was kind of frantically taking notes as you were speaking, because there are certain things there that I definitely wanted to address. So I'm going to share my screen here. And so as I was going through, I was noticing a few things that were very much in alignment with, let's do this. So a couple of things that were very much in alignment with some of the things that we were talking about. Can you see my screen okay?
We just see your video right now.
All right. Let's try that one more time here. Gotta love Teams. Okay. That's more like it.
There we go. We got it.
Okay, perfect. So a couple of things that I thought really were impactful from what Rola was talking about, and I think it aligns well with a seminal study that was done by McKinsey and Company some time back about building strengths in the healthcare supply chain. And I think there were really 5 things that they talked about that fit in well with some of the things that Rola was mentioning. And even though this is back in 2013, there hasn't been a lot of change, which is one of the issues that really have to be addressed. So some of the 5 pillars they talked about were segmentation. That is to say, how is it that we're able to match the capabilities of our supply chain with requirements for specific products? In many cases, there are raw ingredients that are necessary that maybe are common in multiple drugs. And in many cases, depending upon environmental things, some of those ingredients are going to suddenly shift as demand for one specific drug, i.e. Hydroxychloroquine, happens to spike. And what becomes the impact of that on other drugs that require the same raw ingredients? So segmentation becomes key. And how do we appropriately segment to make sure that demand for one drug does not negatively impact demand for other drugs? The second is agility. So the ability to quickly pivot. Now, one of the things that I remember reading was that on average, it takes pharma companies about 75 days to make a substantial adjustment to their supply chain. Compare this to other manufacturing type organizations where on average it's about 30 days. That's a substantial difference. And a lot of it is because of the lack of agility that we're seeing with many of the pharma companies that I've been working with. So how is it that we're able to quickly pivot based upon a variety of changing circumstances? I think one of the things that we've seen is the fact that, given political temperances and things going on, the people who we would typically rely on in the event that there are political disturbances, perhaps we can't rely on as much, or perhaps there's a threat based upon internal or external political factors. So how is it that we're able to quickly make a pivot or adjustment as needed? Third, measurement and benchmarking. That is to say, how do we continuously improve by understanding the costs and the capabilities of our supply chain? I think Rola did a really great job of talking about the overall impact of cost. So how is it that we're able to overall improve our margins or maintain our margins regardless of what happens in one or two? The fourth is alignment. And alignment was something that was a recurring theme of some of the things that Rola was talking about. So the ability to enable that fast, accurate exchange of data. So how is it that I'm able to tie in my supply chain with other supply chains, and I'm able to exchange information, exchange data in real time in a way where I don't have to go through the transformation process. I'm able to get real-time visibility into things like stockpile, supplies, and other types of external information as a whole. And then fifth, collaboration. So Rola specifically mentioned information sharing, the ability to track, report, plan. She also mentioned the importance of engaging diverse stakeholders. And I think all of these things become key to being able to build a new type of supply chain. Now, when we look at some of these operational metrics here, we're able to see some of the potential that exists within pharma. So inventory, for example, on average now with pharma companies is about 258 days worth of inventory. Considering the fact that there's an inherently perishable nature for many of the drugs that pharma companies manufacture, it becomes really important to reduce the overall inventory. And we believe that the potential in a digitally transformed environment is actually reduce that by a factor of 2 to 4 times, all the way down to about 72 days. Obsolescence as well. So the expiration of drugs, in many cases, because it's something of a guessing game among pharma companies in terms of where the demand might be, they will often produce at a consistent level, but that doesn't really reflect the reality of things. And I think this pandemic has really helped to highlight that. You're going to see the demand for certain drugs absolutely skyrocket, reasonably or not reasonably. But you're also going to see the demand for other drugs plummet. Or perhaps there's not an ability to supply because those ingredients have shifted over. And it ends up leading to an unnecessary expiration of drugs that might have used ingredients that would have been great for other types of medications that would have been used. So it becomes, in many cases, a lose-lose scenario. So we believe that using a more intelligent, artificial intelligence type of platform, we can actually reduce the percentage of sales that go obsolete from about 3.1% all the way down to 0.5%. And then finally, manufacturing lead time. Within pharma here, it's between 120 and 180 days lead time for manufacturing. Compare that to some other industries. So industries such as consumer packaged goods, as an example, or manufacturing companies outside of medical or medical devices, they can actually do manufacturing lead in as little as 3 to 7 days. Now, obviously, manufacturing within pharma is fundamentally different, but we believe that we can actually get that down quite a bit. So it requires a bit of work. And I think Rola spent some time talking a bit about some of those factors. So I wanted to re-emphasize that a little bit. When we think about things like preparing the data as an example, preparing the data becomes key. Organizations often have a lot of data, and in many cases, too much data. There's a phenomenon I refer to sometimes as data drunkenness. And I have people who come to the Microsoft Technology Center often with the question of, hey, I hear that artificial intelligence can help me solve all of my problems. And I have all of this data, and so I want to buy like 5 artificial intelligences and point it at my data and solve all of my problems. And it doesn't work that way. In many cases, there's a fundamental preparation of data that's necessary. So how do I clean the data? How do I deduplicate the data? How do I separate data that has value from data that doesn't have value? And so there's an extensive preparation process that you have to go through. The second part of it here is defining an area of need. So where are some of the areas where we can best get predictive information? So within pharma companies, for example, a lot of sensitivity can come from things like political factors. It can come from things like weather data. It can come from things like demand that might take place based upon outbreaks of certain illnesses. So how is it that we're able to define areas of need and then find the right types of input necessary to be able to train AI systems on making the right types of predictions? And the third is assembling the team. So assembling the team here can take on a lot of different forms. It can include everything from, do I have the right types of expertise technically in order to be able to take on this project? Or if not, do I have external experts that I have access to? At the Microsoft Technology Center, we have a team that we refer to as a Delta Force. And Delta Force is a combination of data scientists, data artificial intelligence experts, and business consultants who can all work together to do an assessment of the data that you have and actually help to put together an overall data strategy, as well as help to work out the right types of algorithms necessary to help with what you see over on the left-hand side. And over on the left-hand side here are things like looking at the different types of data inputs. Data inputs can be things like shipment history. It can do things like store ordering history, right? So these are all the different types of factors that we can look at. But it might also include factors, including factors like your weather data. It might include factors like the risk scores of the countries with the supplies that you're looking at, right? It can look at demand type data. It can look at news data. We can actually take all of that once we've gone through a Delta Force process and then apply machine learning to that, similar to what you would see here, where afterwards we can then add that to an algorithmic forecast model and then use that to put together overall forecast outputs that can then include an overall increase in accuracy of the forecast data that you have. So, so an example of what that might look like here can include looking at the comparison of supply chain aggregates. So we look at traditional forecasting as an example, where we can take a look at some of these core, classic numbers. But in this case, if we can shift over to demand sensing over on the right-hand side here, we can fundamentally change the way this works. So by being able to take some of these factors here, we can actually sense where the demand is going to be. So anyone who's a fan of hockey would know that one of the great quotes is, "I don't go where the puck is, I look at where the puck is going to be and I skate there." And that becomes key for this as well. So the ability to now look at the overall sensing of a demand. So how is it that I can overall take a look at the flow of a supply chain based upon many of these external factors, and then take these factors and then predictively go back and say, we're probably going to need to source more of these core ingredients based upon an increase of demand. We're probably going to need to introduce a second or a tertiary supplier because of factors that are taking place politically or economically in some of the countries that we are receiving medical supplies from. And that becomes a fundamental shift in how we do things. So let's talk a little bit about some of the things that we can do with the Microsoft technology. So one of the things that when Rola and I first met after she gave an amazing TED Talk about the supply chain is we talked a bit about the idea of borrowing or blatantly stealing practices that come from other types of industries. And at the Microsoft Technology Center, we have, in Chicago specifically, we have a few different specialties. One of them is retail, one of them is manufacturing, and one of them is healthcare. And in many cases, the best practices that I find from manufacturers are things that readily apply to pharmaceutical organizations and things that they can really benefit from as a whole. So when we think about what an intelligent manufacturer looks like here, it's the ability to do things like proactive maintenance of your assembly line, right, of your manufacturing line. It's the ability to get customized sales to help strengthen services, to be able to predict where the demand is going to be able to predict on what physicians that you have relationships with are struggling with. And then being able to take that and actually leverage that to say, here is where the puck is going to go. So if the puck is going to go there, then we should start making shifts to our overall manufacturing practices early on. we need to get an additional supplier. We need to get maybe 3 additional suppliers. We need to source additional raw ingredients. We need to shift the production lines quickly so that we make less of one drug and more of this other drug. And then being able to intelligently communicate that back throughout the supply chain to quickly help to pivot with the people who become parts of our suppliers. And then finally, using all that information that we've collected from our sales data, from demand data, from external data, and actually use that to determine additional types of products that are going to be necessary to be manufactured. This in turn can actually apply to the ability to ultimately even impact R&D and to look at ingredients that might be necessary for additional types of drugs that you're doing research in. That's a different topic for another day though. So within Dynamics 365, which is a platform that's built on top of Azure, and Azure is our cloud platform that includes a wide variety of AI type capabilities, we can do something really fascinating. We have the ability ultimately to look at factors like all of this data that we've been talking about, right? So we can begin with that, and we can then, let's highlight this here for a little bit. We can take some of this data here, and then we can add this into actionable intelligence through IoT. From here, we can take the data ingested from the IoT and use that to derive insights for areas such as, automation, communicating back out through the supply chain, saying we need 30% more of the supply that you have. So an example of what that might look like here from a technical perspective would be using Dynamics for supply chain management. We can get things like a data feed that can come from these data sources we've talked about to feed in business data. We can run that through Azure Databricks, which will actually help to process the big data that we have there, run that through our AI algorithms, and then use that to feed it back into the supply chain in the form of notifications. So those notifications can include things like, it looks like we are going to run short on some of the supply based upon current inventory levels. It looks like we are going to have an increase of expired product based upon a drop in demand levels. It looks like this particular supplier, based upon some disruptions in the supply chain, might not be able to meet the needs that we have for this demand. We are therefore going to recommend these additional 3 suppliers who are not as impacted by these external events. We can then take all of this and we can turn that ultimately into the types of intelligence that we need in order to make the right types of recommendations and predictions across the supply chain. So a couple of examples of what these business scenarios might look like here can be things like notification services for things like delayed production orders that might take place based upon these different external factors. It might include things like notification services when equipment is down, either in your own facility or in terms of supplier facilities. Notification services for things like quality anomalies. And this is something that Rola mentioned as well. So this idea of having an unregulated supply chain and falsified medications. In many cases, it often comes as a result of, in certain locations, corruption. So the ability to continuously monitor quality and to quickly pivot when there seems to be a problem in quality. So this way, you're not putting out things that you have to destroy, but very quickly we're able to identify, based upon this lot, the fact that there might be a compromised product, and then quickly make a pivot and shift for that as well. The ability to do an automated inventory update from within the shop floor also becomes key. So are we producing things at the right rate? Are we producing things too quickly, right? That might lead to an overall inventory stockpile that you don't necessarily need. And then the ability ultimately to track that. So as it's en route to the different pharmacies that you're stockpiling or that are stocking it, or en route to hospitals who might have ordered it. How is it that we're able to track where it is? Are there going to be delays based upon that? And then ultimately the ability to get operational insights based upon the different types of manufacturing equipment that you have to make sure that it continues to be optimal. And in the event that, for example, the RPMs are on a machine or an operating temperature is too high, or when you're dealing with cold storage, if the refrigeration is outside of acceptable range, to be able to pivot quickly so that you're essentially able to save the inventory that you have. This becomes particularly important for cold supply chain, which is very common overall. So let's go back here and wrap things up a little bit. So scrolling down, there are a few things that I marked that Rola was talking about. Now, a lot of what we talked about here is really specific to, or is really generally speaking in terms of good manufacturing practices or supply chain management. Now, specific to pharma, we have some really important features either with ourselves or with partners who actually specialize in having pharma-specific types of skins that sit on top of our Dynamics platform. And a couple things in particular are here. One of them here are things like attribute tracking and dynamic formula adjustment. So this is the ability to maintain various types of quantitative and qualitative attributes for products and for the lot. And then based upon these predefined ratios to then adjust formulas accordingly. Another one is batch balancing. And that's the ability to ultimately allow different types of formulas to generate quantities that are based upon different types of potency levels. And then using that to adjust ingredient quantities automatically. And that helps to ensure concentration of active ingredients and doing things that will make adjustments in the event that we have to make some sort of compromise overall. Another one is best before dating, right? So we talked about this idea of knowing your correct inventory status as a whole and being able to dynamically adjust the speed of production to make sure that you're not maintaining inventory well past the expiration date. Things like the custom items. So that is those are factors like looking at the various types of inventory dimensions that you have to help overall optimize what your stocking practices look like. And that becomes part of your overall lot management. And it also includes things like where is it currently being used, right? And what becomes the sales within that area to make sure that we are adjusting downward or upward. Because one of the things we find is certain countries will have certain demands that might be somewhat different overall. And then finally, the enhanced picking. And that becomes things like your best before management. So I want to be able to pull inventory in the right types of sequence. So I'm not just sending things randomly, but I'm actually doing things where I'm sending things so that the expiration date happens to match the demand of the pharmacy that I'm stocking or the country where I'm stocking as a whole. Okay. So just to wrap here before we go on to QA, all of these things in general all fit in well to, I think, a few core factors that we'll wrap with. So one of them here is the overall process automation. I want to be able to use more automation driven by AI to make an overall improvement on your productivity and your profits. The second here is agility. I want to be able to support all phases of growth, adjustment, and expansion. That is to say, I want to be able to be agile enough so that regardless of what happens internally on your production line or externally with your suppliers or with even acts of God, to continue to operate in an optimal fashion. The third is cost-effective and adaptable compliance management. Rola spent some time talking about that, this idea of compliance, to make sure you continue to follow good manufacturing practices, even in situations where you are rapidly adopting to a pandemic, as an example. Easy access to business and data intelligence, so the ability to your executives, get a firm understanding of any areas that might be potential bottlenecks throughout your supply chain, and then to quickly pivot and make adjustments. End-to-end visibility and traceability. Traceability was something else that Rola spent a lot of time talking about, and I thought that was really powerful. I want to be able to trace where this comes or where this ingredient goes. So in the event that is compromised, I can find the lots that are there and make sure that I'm making the appropriate actions overall. And all of this in turn fits together into an overall lower cost of ownership that I think is important for pharma companies who are already somewhat stressed when it comes to their overall profit margins. So that is it in a nutshell. So I thank you for your time. So I'll pass it back on to you, Sam.
Yeah, thank you so much, Charles. First of all, I love the use of the Microsoft whiteboard. Everyone noticed that. That was awesome. I think that one of the things that I've taken away personally is just how you can use the Microsoft Suite to get more actionable insights from your data. And when we mix the industry expertise that came from Rola, and we have the technical knowledge that Charles brings, and we combine their industry insights. It really is a powerful combination. So it's been really great to see. I'm going to share my screen here. We have about 5 minutes left. So I think what would be best to do is, let me pull up my screen here. So I think what would be best to do is if we go on to one last question for both of you, because I think that both of you will have insights here. And we've been responding privately to people, but then if you do have other questions that we didn't get to, I'm going to share a bunch of resources afterwards. So we'll post that on the blog. And this is the blog here, aka.ms/HLS blog. So for the last question here, just to wrap it up, I think that one of the things that I took away from Rola's struggle to access medications talk is that it's not just healthcare's problem. And as she mentioned at the beginning, there's no one solution that's going to fix it all. So it's going to be little improvements along the way. Can you talk a little bit about what excites you most about the future improvements to the drug supply chain, and what kind of gets you excited about it and how you see it playing out?
Yeah, of course. I think what really kind of excites me, and something that we're beginning to see a lot, especially within because of COVID and the pandemic, is really the information sharing, right? Like how much we'll be able to have access, or to what kinds of information will we have access to help us do our jobs better, is so interesting to me, right? Especially after hearing everything Charles was talking about as we build up on each other. Wherever you are, whatever role you have in the supply chain, just thinking about not only the information that you receive, and that potentially the information that you put out to the rest in the supply chain is going to be so beneficial. I think it's going to improve a lot of different processes. And so I think that's quite exciting, how we really utilize technology and really understand what is it, the information that we really need. Because even if you think about it from a healthcare provider perspective, and when drug shortages happened, we had to start thinking about, okay, well, if we don't have the information, what is the information that we absolutely need that maybe you could provide that would help us, that would assist us. And one that was very significant was just letting us know ahead of time if you see any disruptions. So if you are no longer going to manufacture this medication, or you anticipate a disruption, when you let a healthcare provider know, they can plan, right? So then there's no disruption in patient care. So I think there's so much power in knowing and utilizing information, and kind of understanding what information we really need, and how we actually can contribute to the overall supply chain by the information that we provide. So,
what she said.
I was going to ask if you had anything to add there. Okay, awesome. Well, I really, really appreciate the insights. This was amazing content from all of our presenters today. And we will definitely also post their LinkedIn profiles if you want to get in touch. This will all be recorded on aka.ms/HLS blog. So thank you for everyone attending, and definitely feel free to pass it along to people that didn't get the chance to attend today via our blog after this. So thank you, Rola. Thank you, Charles. And thanks to all the attendees.
Thank you.
Thank you.
Have a good one.
Take care, everyone.